Hi, Dr. Asham, can we go on?
Yes. All right. Please, can you hear me? Please confirm that you can hear me.
Loud and clear.
All right. So, good evening, everyone. Yes, welcome to this very exciting time. It's another webinar session we have at EHA Clinics Academy. We'll be having our speaker with us this evening to speak on a very wonderful topic, right? And the topic is going to be on, strategies for enhancing, physician well-being and preventing burnout, right? You're welcome to this webinar session, and I hope you would have a wonderful time with us this evening. So we have with us this evening a family physician at J Clinics, by the person of Dr. Dirkat Foyi. You're welcome. Can you say hi, Dr. Dirkat?
Hi, everyone. It's always a pleasure to speak to everyone. Good evening.
Yeah, thank you very much, Dr. Dirkat. Yeah, thank you for being a part of today's webinar, and thank you for speaking with us this evening. So yeah, without any waste of time, we'll just kick in and then start the session for this evening. Thank you, Dr. Dirkat. The floor is yours. But in the meantime, please drop your questions in the chat box. We'll be excited to pick them, answer them, and clarify, every questions you have and provide as much answers as possible as we have Dr. Dirkat with us. Please go ahead. Thank you.
All right, so thank you once again, Dr. Asham. I think you can go ahead to share the slides.
Okay.
So welcome, everyone. You're welcome to another webinar. Okay. So you're all welcome to another webinar called CHA Clinics. So today, this evening, will be, we'll just be talking about strategies for enhancing physician well-being and burnout prevention. Sorry, it's just titled physician well-being, but it's something that you can actually, you can relate it to any service, any occupation that is client service, that you offer client services. You can actually actually relate it to that. So whether you're in the banks, you're a lecturer, you're in the healthcare sector, you're a military man, you're a policeman, as long as you deal with other persons, you can actually relate to this. So you can just substitute the physician there with whatever profession you're doing. All right. So let's go ahead. Next slide, please. All right. So in our discussion today, we have the following learning objectives. Whatever it is, just try and pick something out of the whole discussion, whatever it is. So at the end of our session, we should be able to define burnout. We should be able to identify features of burnout. So here's physician burnout or whatever, lecturer burnout, policeman burnout, whatever it is, burnout. And then we should be able to understand the consequences of burnout. And then we should be able to identify strategies, that can help us to prevent this burnout, and also to prevent burnout, and for people that have burnout, to help improve burnout. Next slide, please. All right, so here's the outline. We'll introduce it briefly. We'll just talk about brief epidemiology because, burnout is a worldwide phenomenon, it's a global phenomenon. So we'll just talk very briefly about that. We'll talk about the causes. We'll talk about the consequences of burnout. When somebody has burnout, what do you expect to see in the person? And then we'll just highlight some strategies that can help to prevent burnout and to also improve burnout. We'll talk about barriers to care because, of course, you come to find out, the causes of burnout, and of course there'll be some barriers to care. I'll conclude, and you'll have my references, which you can always check after the talk. All right, so introducing burnout. So if I ask you what is burnout, if I'll ask you what is burnout, a lot of people have different thoughts of what burnout is. If you have a piece of paper, you can just write it out. Maybe as we go on, you'll be able to know whether you're right about burnout or not. All right, so burnout it's a phenomenon. Actually, it was first coined in the 1970s, and is defined as a state of mental exhaustion, which is caused by one's professional life. And burnout consists of, there are three dimensions: emotional exhaustion, depersonalization or loss of enthusiasm for work, or cynicism towards your work, and then there's a reduced sense of personal accomplishment. Next slide, please. All right, so in the year 2019, the WHO actually included burnout into the ICD, the International Classification of Diseases, the 11th edition in the year 2019. So the World Health Organization, defines burnout as an occupational phenomenon based on, the ICD classification. So it refers to it as a syndrome resulting from chronic. If you see, I put some words in capital. So those are the keywords that you should actually pick. So first of all, it's an occupational phenomenon. Occupational in the sense that burnout comes from our jobs, from our jobs when we're relating with other people. And then it's from chronic, poorly managed workplace stress. Every job has stress, but it's when the stress is poorly managed and it goes on for a very long time. So it's resulting from chronic, poorly managed workplace stress, and it's characterized by feelings of energy depletion or exhaustion, increased mental distance from one's work, which is the depersonalization that I mentioned earlier, or increased cynicism, and reduced professional efficacy. This reduced professional efficacy comes in so many ways. Some people also refer to it as reduced personal accomplishment. I'll expatiate on that. I'll expatiate on all those subsequently. So like I said before, burnout is a global phenomenon. Global has been talked for the past 6 years. People have been talking about burnout. There's been a lot of studies that have come up. People have been talking about burnout because of the effects that burnout, has on individuals and the organizations that they work for, which you would see shortly. So like I said earlier, it was first used in 1970s by Herbert Freudenberger, who is a German psychologist. He observed that he first used the word burnout, just using it as a word. Maybe, these people that have burnout. So he observed that he had a rehabilitation clinic, and then there were some volunteers that actually came to offer service to people that have been rehabilitated. So he just noticed that, over time, as we're offering those services, sometimes they start having, they're looking tired. Some of them stopped coming to work. Some just treated the clients, just treated them as if they were objects and all that. So it was from there that, the whole burnout, the whole burnout thought, started developing. And then another very important person when you're talking of burnout is Christiana Maslach. She's an American psychologist. So she also observed the same term, when she was in some client service providing organizations. So she noticed that there's sometimes that the staff, they would feel so tired, they would feel so distant from their work. They had this kind of energy to do anything. And so because of that, a lot of research has been done on burnout, and she's one of the spearheaders of research in burnout. And because of that, Christina Maslach, she developed a tool, that can actually help in diagnosing burnout, which is called the Maslach Burnout Inventory tool, which has been used by a lot of researchers to help in diagnosing burnout. There are other tools that have also been developed that can help in diagnosing burnout. We have the Copenhagen Burnout Inventory and then the Oldenburg Burnout Inventory. All these are online, so once just search that, you can see. But the one that's been widely used is the Maslach Burnout Inventory tool. Next slide. All right, so this is just a picture of, it seems he's on fire. You can see a clock there. He has tasks that are time bound. He has a lot of notes to write down. There's something like a tab, so probably maybe it's computer based. His work, uses computers and all that, and you can see he's going crazy. He doesn't know which direction to go. So this is just a picture, that we can have in our minds of someone that is having a lot of work related stress, and when this gets poorly managed, it can eventually lead to burnout. Next slide. All right, so talking about just the epidemiology, burnout has a global prevalence. Like I said before, a lot of studies have about burnout have been done, and different prevalences have been found from different areas of the world. So the global prevalence has been found from 10.5 to as high as 85.2% in different studies. There are a lot of studies if you check them out, and then also there's a global pooled proportion of 39%, in some systematic reviews that have been done and meta-analysis as well. So different places have, different percentages of burnout. And then one thing is in making a diagnosis of burnout has three dimensions, which is the emotional exhaustion, the personalization, and reduced personal accomplishment. So because of the way it is, and people are still, doing a lot of research on burnout, some people use having high scores in that's high emotional exhaustion, high depersonalization, and low personal accomplishment. If you have high scores in the whole three, and then they say you have burnout. While some other authors, they just say, okay, if you have just high emotional exhaustion or high depersonalization, you have burnout. So, because of that, sometimes you see some studies and then you see the prevalence of burnout is very, very high, while in some other studies you see the prevalence is low. But generally, what is accepted is high emotional exhaustion, high depersonalization, and then low personal accomplishment, all joined together. So in the USA, their burnout rates are as high as 66.2%, and these are studies that are done in different places at different points in time. So a lot of things can actually affect the burnout rates that are seen at a particular time. In India, some rates of 10.5%, in China, 50.06%. Now in Africa, in Uganda, of course, in Africa we have a lot of issues with our healthcare system in Africa, stemming from infrastructure to staffing, to the physician client ratio, high physician client ratio. And then even when you relate this, to other occupations, for example, for the lecturers in schools, there are a lot of admission rates. The students per lecturer ratio is quite very, very high. If you're talking about the military, the police, the population, per personnel proportion is very high. So because of that, there's a strain. So there's some burnout rates, 57.4% in Uganda, 47.4% in Kenya, in Nigeria, up to about 45% was seen in some government hospitals in Delta, and then in Lauren you can see as high as 71%. And then there are some things that have actually been related to burnout in different studies that have been found to be consistent predictors of burnout. And one of them is age, greater than 40 years. Female physicians have been found to have increased odds of burnout, of course, because they have, other things going on. They have the family front. They have, there are many other things that are going on in their life. So, the female physicians have been found to have increased odds. And then also younger doctors with less than 10 years of experience, of course, because they're younger doctors, they're still trying to streamline, their practice and all that. So sometimes they have a lot of tasks, a lot of jobs, a lot of things that are pushed down on them, So because of that, there's a lot of strain and, a lot of stress for them. Next slide, please. All right, so this is just a chart, and this is just for physicians. There's usually a survey that Medscape usually does every year. So this was gotten from the Medscape Physician Burnout and Depression report, and this is the 2024 report. So it was done in 2023. For 2025, a survey will be done in 2024. So this is the present one. So as at 2018, the first time when the survey was done, and mind you, this survey is just an American survey, because of paucity of research in our environment. So sometimes it's not easy to get this kind of large surveys. And this was done among physicians who practice in the US, and the number of physicians that were able to do this survey were well over 9,000 physicians, about 9,300 or thereabout. So the first time the survey was done in 2018, burnout was found to be 42%. In the 2023 survey, it was 49%. And then presently in the 2024 survey report is 53%. So you can see there's been a gradual rise in the prevalence of burnout. And then also depression is something that is very closely related to burnout. Sometimes some of the consequences of burnout, they might go into depression and all that. So depression as at 2018, it was 15%. In 2023, it was 20%, and in 2024 report now is 23%. So you can see it's also on the rise. So this actually shows that burnout is real, and burnout is a real problem, and it must and has to be tackled. Next slide, please. All right, so this is just for physicians. So this just shows, the trend of burnout among specialties. And obviously, specialties that are more up and doing, have more emergencies. Sometimes they have higher rates of burnout. So 5 years ago, of course, family physicians, the burnout rate was 47%, but presently it's 51%. So it means burnout is increasing, stress levels are increasing. For the internal physicians, burnout initially was 46%, but now it's 50%. For emergency medicine, it was 45%, now it's 63%. And if you look at the burnout rates showing the specialties that have the highest burnout rates, you can see emergency medicine has the highest burnout rate, 63%. And it's obvious because of the work hours and all that, the patients that they have, the procedures they have to do. Followed by obs and gynecology, then oncology. Of course, a lot of people are coming down with cancers, so the patient load is actually becoming so much. And then pediatrics. And then the specialties with the least burnout are ophthalmology, plastic surgery, psychiatry. They just take their time to do things, take their time, and it seems they have less stress anyway. So let's go on. All right, so causes of burnout. If I'll ask you now, what do you think are the causes of burnout? If I ask you what are the causes of burnout, for you to write it down, what would you say? I know many people will say, okay, workload. I'm sure that would be the first thing that would be among the causes of burnout. But well, it's good to know that there are many other causes of burnout, and these causes of burnout could, it's a wide array of items. All right, so next slide, please. All right, so the major causes, these are the major causes of burnout. Major causes. There are other minor causes, which I'll just highlight some of them. But these are the major causes. So the first thing is the workload. Of course, workload. The higher the work, the more stress levels. And when that goes on for a very long time, you have a high level of burnout. So workload is one of the things. So apart from the workload, the work environment, is the environment conducive? How are the noise levels? Are things available for you to walk around? Sometimes workload can be high, but when you have things that support you at work, it can actually help make your work better. So all these things lead to that. So workload is one of the highest things, and then having meaning at work. Sometimes you do work that you're just going there just for the salary. You're not really enjoying the work. So even when the workload might not, really be so much, but because you're finding no meaning at work, so it just seems as if you're overwhelmed at work. So one of the major things is workload. And then the next thing is perceived lack of control. And this perceived lack of control, when we talk about autonomy, coming to work, are you free, to take decisions, to do things, or your center is just based on clinical guidelines, nothing, you can't think out of the box, just left or right, just the clinical guidelines, or you're just stuck on organizational rules. Don't do this, don't do this, don't look left when you're at work, look straight, don't look right, answer this way. When you have all those things, the individuals, they seem as if, they don't have any autonomy at all. And, they have a lack of control at work. You can't control anything that you're doing. So that's one of the major causes of burnout as well. So another thing that goes hand in hand with workload, is reward. And this reward comes in terms of financial rewards and psychological rewards, or other things, social rewards as well. Of course, many people work for salary. So if you're working somewhere and then the workload is so much, and then your salary is so small, you won't you won't really enjoy that work that much. And then, when there's a work reward mismatch, that can actually lead to burnout, because sometimes people might just manage it for some time, but eventually the strain comes on, because when you're having a lot of work and then the financial reward is actually very low, not forgetting that you have a lot of stressors outside, you have demands outside, that can actually lead to burnout. So the next thing is your work community. When I say your work community now, I'm talking about the interpersonal relationships that you have as with your own colleagues, the other staff at work, as well as the patients you see. So how do you relate with other people around your work? Do you have a good relationship? How do you relate with your managers? How do you relate with your younger colleagues and all that? So work environments that are toxic, work environments that don't have good interpersonal relationships, obviously will lead to a lot of strain and a lot of stress, because there'll be a lot of blame game ongoing and all that. So once the work environment is toxic, definitely over time, the stress levels will increase and eventually they may have burnout. So also, how do you relate with the patients? If you're in the health sector, how do you relate with with the patients that you see? If you're in the military, how do you relate with civilians that you go to guard or protect? If you're in the bank, how do you relate with your customers, the clients that come to the bank? If you're in the wherever you are, whatever it is, as long as it's a client service providing organization, how do you relate with the clients? Do you have to follow strict guidelines? Do you have to follow a particular way? How are the clients? Are they appreciative? Are they very toxic clients? All those can contribute to burnout. So another thing is fairness. Where you're working, are decisions, are they being fair? The organization, is it being fair to you? Do they treat you as well as the same way they treat other people? Or maybe some other people, maybe this lady is fair skin, and then maybe they're giving her fair skin privileges, and then you're dark skin, they're just saying no, all those kind of things. So fairness, is there a lot of bias at work and all that? So all those can actually affect the individual psyche and eventually increase stress levels and eventually lead to burnout. So values mismatch. Well, values, because when you're working in a company, do your values align with the values of that company? Sometimes that's why when you have interviews, people ask you, your short-term goals, your medium-term goals, and your long-term goals. So if your values and the values of the company, they don't match, your values are different, the company is telling you to do something different, obviously your stress levels will go high and you might come down with burnout. And then the last thing that is very, very important is lack of work-life balance. Are you just all about work, 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 and and you have no life outside work? It can't function, it can't work that way. A lot of people come down with burnout. So you must have that balance between your work and your life outside work. Once you're at work, you do your work. Once you're outside work, do other things that make you happy. Have your social connectedness, reach out to other people, have your social network, have other things, that will make you happy, your family, your friends, and all that. So you must have a work-life balance. Next slide. All right, so this is just the picture that you can just a general picture. Major causes of burnout. Next. All right, so there are those were the major causes that we just talked about. So there are other minor causes. Now electronic medical records is one of the things that's been found. In fact, not just electronic medical records, any system that is being computerized, a lot of people, have stress, have increased stress levels because of that. And why is because you have to do your documentations appropriately. You have to improve your computer skills. There are many things that you have to type. Sometimes you might have network issues. There are a lot of documentations that you have to do. So wherever it's computerized, it has been found, to actually increase stress levels. And more importantly, the electronic medical records in the healthcare sector is one of the major causes of stress levels and burnout. The medical records can cause you eye strain because you're on your computer all the time. It can, because of the mental work that you're always doing, you can have some mental fatigue, processes that you need to complete, a lot of things, that you have to chat, unlike if you're just writing on paper, there are a lot of things that you can easily do. But when you're using the computer, you have to click here, you have to find where it is, you have to type it properly, you have to make sure it's sent, so all those kind of things can actually lead to burnout. So we mentioned this before, poor interpersonal respect, that's your community at work. You should have mutual respect. Um, and then you should have clear-cut roles and responsibilities. Everyone should know what he's supposed to do. You don't jump into another person's role and responsibility. Everyone, it should be well defined, and there should be mutual respect for everybody. And then we talked about system overload when you have a lot of things to do. We talked about the patient load initially. So when you have high patient load, and then your mental overload as well. And then, another thing that leads to burnout is the culture of training you have. Sometimes, like in the military, they say you continue just obey before complain. So whatever it is, whatever you have your reservations, obey first before you do anything. So same thing with our whole medical training. They say no, you must walk even if you're sick. You must see your patients, whatever it is. So physicians and other healthcare workers tend to hold a lot inside. They just keep they just keep doing the same thing, keep doing it. Somebody is sleeping, but you must just offer those services. So all those things are actually some things that can actually lead to burnout. And then personality traits as well. The perfectionist. No, I must do it exactly like this. I must enter it. When you're entering your medical records, no, there must be no typos. It must be well spaced. I must enter everything. I must write it properly. So the perfectionist is one of the things that can increase stress levels. And then the fear of mistakes. No, I want to do it this way. I don't want to make a mistake. I want it to be perfect, And then self-unforgiveness. When anything happens, you just feel so much guilt. I'm the one that caused this, it's because I didn't chat properly. I didn't do this. I didn't do that. So all these are other causes of burnout. Next. All right, so Drummond is an American family physician, who identified he had a lot of interaction, 1,500 hours of interaction with a lot of physicians who were burned out. So he was able to identify five major things that cause burnout. So that's the practice of clinical medicine. So he just identified as long as you're practicing clinical medicine. Of course, like I said earlier, clinical medicine, you're interacting with individuals. So this, you can also relate it to other things. Any other thing that you're practicing, as long as you're relating with other people, with other human beings, So that's the practice. So you can just generalize that as practice of client-centered services. We can put it that way. That can actually lead to burnout because of the fact that you're interacting with other people, and then you have your own needs, other people have their own needs, and as well as the client load that you experience. So one specific job, what is that job that you're supposed to do? Are you well adapted to that role? Do you have the requisite skills for that? Have you been trained, and have you had retraining for that particular job? Are you competent to carry out that role? So that's one of the things. Once you have less competence, sometimes you have a lot of strain, and you're trying to you check up a lot of things, and you don't just fit into the role. So that's one of the causes. And then having a life outside work, like I mentioned earlier, you must have a work-life balance. You must have a life outside work. And then character traits, which we talked about, and then the influence of leadership skills of your supervisors, and that is the community we talked about. How do you relate with your immediate supervisors? How do you relate with your colleagues? Next, please. All right, so why is it important to talk about physician burnout, or why is it important to talk about burnout and how to manage it? And one thing that is very important is because of the consequences. Burnout causes a lot of issues, a lot of problems. So it's very important to talk about burnout, and also because we've been saying that it's a global phenomenon, and it's been happening over time, and it's documented, it's evidence-based that over the past 5 years, burnout rates have actually been going higher and higher and higher, and we must talk about it so that we prevent the very there and bad consequences of burnout, which could lead to a lot of psychological issues, including anxiety, depression, and even suicidal attempts. Next slide. All right, so burnout has a lot of consequences. Burnout can lead to a lot of things, and these consequences can be on the person and can be on the organization that the person is working at. So on the person, burnout can lead to psychological distress. It can lead to a lot of anxiety problems, can lead to depression because, over time, when the coping skills are not able to cushion the effects that they're having, eventually they go into depression, anxiety, so many things. And eventually, some might have suicidal ideation, some might actually have suicidal attempts. There are a lot of studies that have shown, increasing rate of suicide among, healthcare workers, especially physicians, as well as depression. And then, because of the psychological distress, people have different coping strategies. Some use alcohol, some use substances and all that. So because of that, they have negative coping. They develop those negative actions. So developing those things, they take a lot of alcohol just to cope. Some take a lot of other substances, either to keep them alert and all that. And then because of that, they start having, substance misuse, substance harm as well. And also they might have dependence on all those substances. So it can go a long, it can just go, it can just go it can just go south, it can just go south. And then because of the psychological issues that they have, when they have burnout, they can actually have broken relationships. And these relationships are both with their immediate community, that's at work, with their colleagues, with the supervisors, and then also at home with their families, with their friends. They can have a lot of strain and broken relationships. And then because of the burnout, they're having a lot of, like I told you, the burnout is 3 dimensions. It's emotional exhaustion, depersonalization, and decreased personal accomplishment. So because of the depersonalization, you start seeing other clients as if they're not human beings. You just see them as objects. So you don't really have that empathic feeling. You just see them as just objects that you're coming to deliver a service to, and then they just go. And then because of the exhaustion, that you're so tired, you have mental exhaustion as well, you have physical exhaustion. So because of that, they are prone to making a lot of medical errors. And obviously, when you have those kind of medical errors, there's a risk of you having sued and having increased lawsuits as well. And then eventually, when it becomes untackled, there's actually a change of practice. So whether you're a lecturer, when burnout becomes so much, sometimes you just drop out and then you just want to do something else. When you're a healthcare worker, it becomes so much and then you become distant from your work. You just want to take a break and just be on your own and do something else. So it has led to a lot of change of practice. Next slide. All right. So like I mentioned, the depression rates are high. These have been documented. There are a lot of studies that have shown that. And then also substance abuse, it's increasing because those are some of the negative coping strategies that some people use, as well as physician suicide. This has been documented and it's actually increasing. And then 48% of physicians report actively planning to leave clinical practice. Like I told you, this is a study. This is an American study. So this was actually, a report gotten from a study. Next slide. All right, so I'm sure in a point in our lives, we've been something like this. So you can imagine what could be going through our mind. So many things. Maybe she's thinking of a family, she's thinking of a job, she's thinking of how she could balance life. She's just exhausted, So a lot of things could be going through our mind. So this is how when somebody is exhausted and is going through burnout, the person can appear that way. So burnout, like I said, it can affect the person, it can affect the patients that the person is attending to, or the clients, and then it can affect the organization. So on patient care, there's a potential for decreased quality of care, of course, because the clinical output or the service output becomes very bad. So you have a lot of unsatisfied clients. Increased risk of errors, of course, and that can reflect on the patient, poorer health outcomes and all that. And that can also lead to, of course, they'll always be dissatisfied when you prescribe the wrong drugs, when you handle your clients the wrong way or with your clients. Obviously, there will be a lot of dissatisfaction. And then because of that, there will be a lot of physician and staff turnover. And then this increased turnover will actually affect the patient care, because, sometimes patients might be used to somebody, they come, the person has left, or when there's a turnover Of course, when the other staff leave the work, a lot of work goes to the other people that are on ground, and that can also increase stress levels for those ones that are on ground, and also lead them to experience some burnout. And obviously, to lead to poor health indices, when you're having a lot of errors and a lot of patient dissatisfaction, some of them just decide, okay, I'm not coming for this service anymore. If it's students, this lecturer is just behaving this way, okay, I'm not even going to school, I'm just tired, I'm fed up, So poor, whether it's academic indices, health indices, or whatever, it can affect that negatively. Next slide. All right, so an organization, when you have an increased turnover of either medical personnel, whether staff in general, of course, when the new staff come, you need to train them again, and then you're going to use a lot of resources training, the new people that are coming. So, there's going to be an overuse of resource, and then there's going to be an increased cost to the organization as well, because you're training people, others are leaving, you're training those ones that are coming again, and the cycle just goes on and on and on and on. And then obviously more physicians will leave the workforce because, it reaches a point that they can't take it anymore. They're not seeking help. They're just exhausted. They're exhausted and distant from their work. They can't, and they're not seeking help, So they eventually leave the workforce and just look for something else to do. And obviously, the more the people leave, there'll be shortage of physicians or shortage of whoever is delivering, this decline services. And obviously that will lead to an increased population of people that need that service. And then obviously, wherever the person is working, because of the errors you're having, and then they're suing, after they sue, obviously the organization too will also be held as well for either malpractice or whatever the litigations are against. Next slide. All right, so what are the strategies to manage burnout? The strategies to manage burnout, first of all, you need to identify and measure burnout. And like I said before, we have many tools, but what is used commonly is the Maslach burnout inventory. It's like a 27-item tool. You can always check that it's online. You can use that in organizations or whatever. Any organization that offers client services, like I listed before, you can actually, there are a lot of the burnout inventory tool has been adapted to different organizations. So it's not just for health, it's adapted to client services, to lecturers, and a lot, just any organization that offers client services. So we need to identify and measure burnout to know that, yes, actually this will have burnout, because sometimes you have just exhaustion. I'm sure at the beginning, if I would have given the opportunity, for people to give their words on what they think burnout is, I'm sure some people just say, okay, stress at work, getting tired, So, but burnout is a lot more than that, So you need to identify and measure burnout, and then you need to identify the factors that are causing burnout, because if you know the factors, it will be easier for you to provide solutions to those factors, and then to tackle burnout. And then the third thing is to take steps in addressing the burnout, and these steps can be directed at either the physician, or it can be majorly at the organizational level. But most of the steps to manage and mitigate burnout, most of them are directed to the organization. Next slide. All right, so like I said, next slide, it can be individually directed or to organization. All right, so one of the major things, the first thing, we'll talk about the strategies in managing burnout in individuals. So the first thing is resilience training and mindfulness. This is very important. You can read a lot about resilience training, and this is just there are a lot of courses that do resilience training and mindfulness, but yeah, sometimes it's actually difficult to get some of the free courses, but some are paid courses. But there are a lot of things that, and there are some things that you actually do that you think but you don't use it. But when your that is said to you, then you actually realize that, yeah, actually I know this, but I don't practice it. I know this, and actually when you practice that, it actually helps. So resilience, when we just say resilience, is a collection of personal qualities, just individual qualities that enable a person to adapt well to wherever he is, and to thrive in a place where there are a lot of stressors. So that's just what resilience is about. And like I said, in resilience, you can pick, I put 7 C's or 7 pillars. So why I just left this is so that whichever one you can pick and it's easier for you, that's fine. So talking about the 7 pillars, of resilience, you have to, first of all, we talk about the acceptance. You need to accept that, there are sometimes stress at work most times, you can't avoid stress at work. Stress will come, but how do you manage that stress at work? So you need to accept that there are some things that can't change. There are some things that can't change. You can't say, "Oh, I wish I was just working somewhere that there's no stress and all that." You need to accept that every work has its own stress. And the stress comes in different levels. So the first thing is that you need to accept. And then the next thing is optimism. You need to be optimistic about your day-to-day activities. Yes, even though there's stress, I can pull through. Even though there's stress, I can find ways around the stress. Even though there's stress, I can delegate tasks and know how I can go about it. You need to be optimistic about your work and optimistic about your life. And then another thing is you need to stop being a victim. Don't think that everything is just you. Don't think that because patients are coming, it's just because they want to create a lot of work for you. Don't think that everything is you're the victim. They're doing assessments is because of me. They're giving protocols is because of me. No. So you need to stop being a victim and know that you're better than that. And then we need to have solution-oriented approaches. When you see something, look for a solution, discuss with, you should always be open to discuss your solutions to problems with people. Eventually, when we come to the organizational, we'll talk about organizations having opened up policies, which is one of the good things that HA Clinics has here, opened up policies. So you should be able to prefer solutions to anything you see. You see a tap leaking, prefer a solution. When you see it, you report it and then give it a solution. You see patients, or clients having increased waiting time. Think about it, have a solution, prefer a solution, and then discuss it with your colleagues and other people. So you need to take responsibility. Take responsibility for your actions. When you do things that are negative, take responsibility for it and then move ahead. You must have your social networks. And these social networks can either be religious networks, friends, or your social activities like your hobbies, whether it's reading books or whatever. And then you must always plan for the future. Don't just think that everything is just now. Have short-term goals, have medium-term goals, have long-term goals. Next, please. All right, so we can always look at the picture. This is just talking about characteristics of a resilient person. So next. All right, so another thing apart from, okay, so talking about the mindfulness is just, when you say mindfulness, is just different things that we use just for you to be mindful of the situation you're in. And it's actually close to, the 7 pillars of resilience. So the mindfulness is that when you see things happen, you have to, you reflect on them. You try to get the positives out of those things. You try to do things, when you say mindfulness-based stress reduction intervention, you're mindful about the situation and then you're actively taking steps, to abate whatever it is. So mindfulness can come in different activities. You can have exercises, you can have meditation, you can have deep breathing exercises. When you have situations, you take deep breaths, in, out. You can have, there are a lot of things. You can have thought awareness and all that. So mindfulness is actually a training that you can actually, and there are many resources online that you can actually check for mindfulness training. Okay. So rational emotive behavior therapy, yes. So this is another thing. Many of all these things, they're like cognitive based form sort of approaches, just affirmative approaches that tell you that whatever the situation is, you can always find a positive out of it and you can pull through out of it. So it's just a way of, self-affirmation. So in rational emotive behavior therapy, you just target unhelpful beliefs by, you recognize those issues, you assess those issues, and then you implement choices and skills that can help you in preventing those things. So it depends on whatever it is, whatever is that stressor you're having. You just have to find ways around it and then find how to tackle them. So that's just about rational emotive behavior therapy. So in stress management techniques, we just talked about that. So you can do a lot of relaxation training, massage, meditation, whether it's yoga or whatever, exercise. Some people exercise to reduce stress. So many people sleep, to ease stress. So that's one thing that you can actually do. And then please, if you have burnout or you're experiencing any mental distress, please always get specialized help. So specialized help you can get the help from psychotherapists, from your doctors or from wherever, from your healthcare providers, wherever they may be. And then it can come in form of cognitive behavioral therapy, where this is just a form of therapy, refining the way you see things and then refining the way you respond to things. So that's the cognition, thinking, behavior. How, when you think about something, how do you react to it? And therapy. So there are many other things. Next, please. All right, so we've talked about this. So change thinking process, try and involve, try and do teamwork so that you can do task sharing, to help reduce the toll of work on you. Let there be a lot of staff engagement, within the organization. When you see things that you have issues with, you need to be open, with your colleagues and then with your immediate supervisors. And then EMR control as well. Like I said before, the EMR is one of the major causes of burnout in most institutions. So just try and, as you're seeing whoever is, as you're seeing the client, just try and finish your notes in real time. Make sure you don't take any work home. And then when you have typos, when you have missing full stops and missing I's, please just leave it that way. Don't go back after your work that you're trying to, remove all the typos. Just leave it that way. And then you can also improve your ergonomics. If your seat is bad, you try and reduce support. If it's giving you a lot of back pain, you try and complain to your supervisor so that can make work better for you. You can get laptop stands, a lot of things that you can do to just improve the ergonomics of your work. Next slide. All right, so like I said, the chunk of the work remains on the organization. In fact, I would say more than 80% of the strategies to mitigate burnout lies on the organization. And then one thing is staff engagement. When you have your staff, you need to talk with them regularly. You need to identify areas where they're having issues, especially through their immediate supervisors, because those are the people that actually talk and relate with them more often. So you need to have a lot of staff engagement so that you know where people have issues, where people need some improvement, where people need you just need to engage your staff, and then you need to give them that sense of autonomy. Yes, even though you have guidelines and you have all that, but you should also welcome their suggestions and all that, and you should be able to incorporate that into the organizational policies. So organizations can also create physician wellness programs, especially this burnout, like something like this burnout webinar that is coming on. At least it increases the awareness about burnout and how you can seek care and how you can identify burnout as well. There are a lot of podcasts about burnout, and there are a lot of programs that discuss burnout. So it's something that organizations can key into, to help mitigate burnout. And then the work environment should be very, very healthy. No toxic work environment. Door policies should be open. There should be a cordial relationship with everyone. You should be able to talk with your staff, and you should be able to have that good relationship with your immediate supervisor. Once if you find out there are toxic relationships, you should, as much as possible, try to go to the root of the problem and try to reduce that. Increase compensation, of course. When people work overtime, try and compensate them for that. It gives a sense of like what is called compensation. So they don't have that kind of strain that I'm being overworked, I'm not paid well. The rewards should be good. And then compensation doesn't always come just with financial rewards as well. You can give time off for them to cool off and all that. So work schedule too should be quite manageable, if as possible as it can be. Let the schedule be something that you can work out with your employee. Try and make it more flexible so that they can actually be able to promote their work-life balance. Because, like I said, that's very, very important. The work-life balance should be a very, very important thing in any organization. Let it not just be all about work. We need, the staff always need places to go and when you deplete your energy stores, you need somewhere that you go and replete it. So you must have a work-life balance. The Chant et al. The study that the Chant et al. Did, and then they identified 4 things that can help mitigate burnout. And one of them is teamwork. Like I told you about the community. Work as a team, delegate tasks. Then time management. try and reduce, have more time for yourself. Then transitions, when you're moving to another role, how do you transit? And then technology as well as AMR to try and make it more friendly and for people to be able to handle it. Next. All right, so some other things, yeah. So now we're having a lot of AI, being incorporated into medical care. So that has actually it actually helps a lot, in reducing the work strain and all that. So there's a lot of AI work going on. There are a lot of AI programs that can help detect cancers and also help in streamlining, cancer management as well. So we also have the electronic medical records that is actually supposed to make things easier, but sometimes because some processes make things hard. So I have a lot of mobile health applications, like AHA clinics here that have a lot of apps, that we use we use to help improve client services and like the EHA clinics, we have the EHA clinics HealthMate, we have EHA Care, and then we also have some websites, that you can actually go on, like the Nutri Plus. You can go on to, get a diet plan and all that. So when you do that, it actually reduces the load. Like if you're going online to get a diet plan, which is already made there, it actually reduces the number of people that will have interactions with, let's say for instance, a dietitian that would have actually increased the load there. So also telemedicine, which EHA also does, telemedicine at the comfort of your home. You're able to call in, instead of, and then get healthcare. And then also patient engagement on social media, like what we're doing now. Next. All right, next slide. We're almost done. All right, so now we already know the causes, we know the strategies. So now what are the barriers to getting help? Because I can assure you that a lot of people that know they have burnout, know they have psychological issues, but they don't get medical care. So one of it is stigma. When I go, people will think maybe I'm lazy, or they'll say I have depression, I'm going to see this one. So that's one of the important barriers to getting help. So another one is self-treatment. When you're feeling down, you just stay at home, you just take some vitamins, you say, okay, I'm okay. You just try to treat yourself at home. So and in doing that, you don't get the right care that you should have. Another thing is the repercussions. Okay, if I go and get care, if I go and get help now, people start looking at me that I'm trying to dodge work, I'm doing this, I'm trying to push tax to other people. Or some will say, oh, well, I'm too busy, I don't have time, I'm seeing a lot of people, I don't have time to see any therapists, I don't have time to get help. So Moya et al. Is research, they developed perceived barriers to psychological treatment, for burnout. And then they found 8 major factors, which are stigma, lack of motivation, emotional concerns, and sometimes they have negative evaluation of therapy. Yeah, this therapy doesn't work now. Why are you wasting my time to tell me to go and take this kind of therapy? And then misfit therapy to needs. I say what I have, no, this therapy won't solve what I have now, so there's no point going. Then time constraints, like we talked about, and then participation restrictions. Okay, maybe I'm having muscle pains, I can't go there, I'm just so tired, I can't go and participate. And then also the last thing is availability of services. Yes, I know I have burnout and I have these conditions, but I don't know where to get those services from. So those are some of the perceived barriers to care. Next slide. All right, so I hope we'll be able to pick something, no matter what it is. At least we'll be able to pick something in this webinar that we've had. So in conclusion, I want you to always notice that you have choices. Whatever it is, you have choices. And you have choices of either coping with your stressors positively or negatively. Or with choices. And then you always know that you're resilient. We always have those inbuilt characteristics that can help us pull through whatever situation we are in. So just know you're resilient, know you're intelligent, educated, and hardworking. Whatever you're doing, you're there because you work so hard to do it. And then when you're troubled, please always speak to someone. Please reach out to your primary care provider. Please reach out to your colleagues. Please reach out to your family and friends when you're troubled. Thank you. So I have some references here. If you want to check further, you can go to the references. Thank you very much for your time. And in case you have any questions, I'll be ready to take any you have. Thank you.
All right. Thank you very much, uh, Dr. Dirkat. Yes, thank you. So please feel free to drop in your questions at this point. Thank you very much. And very detailed uh, presentation. I learned a lot. Okay, those three things that you mentioned: emotional exhaustion, depersonalization, personalization, take confidence, and then the fact that you said it's chronic cost estimation at the workplace, right? Yeah, and then a few steps of how to manage my own burnout whenever I next Dr. Dika. Yeah, so questions can come in now. Please put your questions in the chat box. Let us begin to, look into them. Yes, so I can see, okay, we have two questions here in a box. I'm going to be reading them out now. Okay, so one says, as a manager of your practice, you are given certain targets. How do you task successfully putting your staff in work burnout situations? Should I say this? Should I add the second question, or you want to take that one?
No, let me just answer that. So,
Okay.
as a manager of your practice, you're given certain targets. How do you task your staff for high productivity and successfully avoiding putting your staff in work burnout situation? So, one of the things that I talked about is assigning tasks and roles to different people. So, when you break down, all those tasks and assign them to different people, it actually reduces the burden of just saying, okay, we have these tasks, we need to do this. So just break down. Once you just break that down, those targets, break them down into tasks, and then assign those tasks to people that can take it that can take care of that. So once you just do that, and then another thing is time management. If Let's just try and manage time. If you're going to have meetings or whatever for that, if it's going to be 1 hour, please let it just be 1 hour so that people can have some rest and do other things. But the main thing is task sharing. Task sharing.
All right. Thank you very much, Dr. Dukat. Another question is, as a staff of an organization with very high workload and target, how do you manage burnout?
Yeah. So if in the course of the whole presentation, we talked about the major causes of burnout, which is workload. Okay, workload. And one of the things is, like I told you, the how to mitigate burnout. A high percentage of it lies on the organization, even though the person has his own strategies. So for the organization, of course, when you have a high workload. Of course, the workload, if it's a client service providing organization, if there's high workload, it means that the staff strength may be low. So it's on the onus of the organization to try and see how you either reduce those workload, reduce the client services that you're offering, or increase more staff that can be able to take care of that. But once you just put a lot of workload on someone, as long as the organization doesn't tackle that, no matter how your resilience keeps on going, as long as the workload continues for a very long time, you're bound to have burnout eventually.
All right. Thank you very much, Dr. Please keep the questions coming in. The next question is, what are the three markers of burnout?
All right. So the three markers, like I said, there are three dimensions of burnout. So that's emotional exhaustion, depersonalization, and reduced sense of personal accomplishment. So emotional exhaustion is just usual. You're just exhausted. When somebody says I'm stressed, what the person actually means is that I'm really exhausted. So one of it is emotional exhaustion. The second thing is depersonalization. When you come, you just see, if you're offering services, you see the clients you're offering, as they are nothing, you have no empathy. When somebody comes, and assuming you're a healthcare personnel, when somebody comes and says, I have headache, you say, so you have headache since 3 months ago, why are you coming today? All those kind of, you're just distant from your work. And then the last thing is you start having reduced sense of personal accomplishment. You don't just feel you're accomplishing anything. For the past 1 year, you just feel you're just in the same place. You're not moving ahead. So those are the three markers of burnout. Those are the three dimensions of burnout.
Okay. Thank you very much for that. You can keep the questions coming in. Thank you very much for the ones we've had so far. Does anybody have any questions that I can ask? I'll just give them for one. You can raise your hand and then say something. Okay. All right. Well, thank you, Dr. Dilkat, once again for this very detailed and wonderful uh, presentation on how to manage burnout. I think I'm a better relaxed to be able to see how I can handle that. Thank you for the efforts. Yeah. Any closing remarks? Obina?
Well, thank you, Dr. Dika. I think this has been a very, very wonderful and educative webinar. I wish we had more people join in. But like we all know, for those of us who have participated, this will be, you would have access to this presentation eventually, and the slides will be graciously given to us, and then you can have a certificate of attendance. You can engage with the material, and if you have any further questions, you can relate to us directly, and we can connect you with our dear Dr. Dikat. Thank you, Dr. Dikat, for your time. We really appreciate the labor and the beautiful presentation this evening.
Yeah.
Always a pleasure. Always a pleasure.
Okay. All right. Everyone, thank you for being part of this very wonderful webinar session with EJK Academy. When we took out the time to join in this evening, enjoy this very presentation with Dilkat. And we'll see you another time with more exciting topics and very good speakers as well. All right, for now, this is bye-bye. Have a wonderful evening. Bye.
Bye, everyone.
Bye, everyone. Good night.